Hello and welcome to the City Clinic at Cardiff Royal Infirmary. The City Clinic is a specialist clinic for men who have sex with men over the age of 16. Within the City Clinic, we offer testing for sexually transmitted infections and vaccinations. We can test for chlamydia, gonorrhea, HIV, syphilis, hepatitis and herpes. We offer vaccinations for human papillomavirus, hepatitis A and hepatitis B. You should be aware that it can take a while for certain infections to show up on tests. For HIV, this can take anything from 4 to 8 weeks to show up in the blood. For syphilis, this is up to 3 months to be able to become positive in the blood. For chlamydia and gonorrhea, our swabs in urine tests can take up to 2 weeks to show up. We're just going to give you some information now about different sexually transmitted infections. HIV is an infection found within the blood and bodily fluids. It can take a while to show up in the body. This is why we often recommend repeat blood testing. The main things you need to know about HIV is the fact that it can be easily controlled with medication. We need to talk open and honestly about HIV to help reduce the stigma associated with this infection. If you are concerned that you've had sex with someone who has HIV, the main thing you need to worry about is someone's viral load. If someone has an undetectable viral load, then we know the risk of onward transmission is minimal. If you have sex with someone who has a detectable viral load, this means they are not taking HIV medications to control the infection, then we would recommend you talk to us about HIV post-exposure prophylaxis. This is also known as HIV PEP. It's like the morning after pill, but for HIV. It also needs to be taken within 72 hours of exposure. Syphilis is another infection found within the blood and bodily fluids. We need to obtain a blood sample to be able to test for syphilis. We've had a big increase in the amount of syphilis cases in the area recently. This may be because people become infected with syphilis and they don't realise. Syphilis can present itself as a painless ulcer, so therefore people continue to engage in sex and expose other sexual partners to the ulcer and pass on the infection. Syphilis can be easily treated with some antibiotics, but we like to follow people up for a year after infection to make sure that we've successfully treated the infection. Chlamydia is a common sexually transmitted infection. For gay men, you can find the infection either in the mouth, in the rectum, or in the penis. It can present itself as a pain on passing urine or as a discharge. It's easily treated with some antibiotics, but we do like to test and treat any recent sexual partners just to try and prevent onward infection. Gonorrhea is another common sexually transmitted infection in gay men. You can find the infection either in the mouth, in the rectum, or in the penis. It can present itself as pain on passing urine or a kind of thick discharge. We test for gonorrhea with a urine sample initially. If we think you have gonorrhea though, we also need to take a swab. This is to make sure that we use the right antibiotic to treat you. If you've heard of supergonorrhea recently, it will also remind you why we need to test 3 weeks after treatment to make sure the infection's gone. The City Clinic can also provide vaccinations for human papillomavirus, also known as HPV, hepatitis B, and hepatitis A. Human papillomavirus, also known as HPV, is the virus associated with genital warts. It can also be associated with oral and rectal cancers. We provide 3 injections. This can be over a 6-month period. Hepatitis B is a liver infection. We can provide 3 injections over anything from a 2-month to 6-month period. It's also a common travel vaccine in some places. Hepatitis A is like a sister to hepatitis B. Both of them are liver infections. Hepatitis A is normally transmitted through certain sexual activities, normally rimming. If you engage in this, then we would recommend having the 2 vaccinations. This is over a 6-month period. The City Clinic can also provide the initial assessment for HIV pre-exposure prophylaxis. HIV pre-exposure prophylaxis, commonly known as HIV PrEP, is the use of a HIV medication to help prevent you becoming infected with HIV. To enter into the Welsh Assembly's HIV prevention study, you need to be engaging in unprotected anal sex, or you need to be having plans to have engaged in unprotected anal sex. The current study is going for 3 years, and we have a patient caseload in Cardiff Royal Infirmary. The results from the City Clinic are texted directly to your mobile phone. Please ensure that you have given us the correct mobile phone details to get your results. It can take up to 3 weeks for you to get all of your results back. If we do phone you, don't worry. Sometimes we just need to repeat tests or clarify details. If you have not received your results within 3 weeks, please contact us.